So it all started with the invitation letter for the cervical screening. I mean, nobody really likes to go to the screening, but it's just one of those things that you do. So I booked the appointment. I remember it was the 1st of October. I went just thinking it'd just be a normal smear test. I mean, it's never a nice thing that you're going for your smear test, but it's a short test relatively that could or can save your life. My name's Catherine. I live in Cheadle with my husband Oliver. We always say our first year of marriage was not the best, but nothing to do with us. It probably made us stronger, but we had COVID and cancer. The first time I did hear the word cervical cancer was when I was told I had cervical cancer. But I'd been for the smear test, which it was really painful. So I was advised that I could go for a colposcopy at the hospital, because then they'd be able to do a more detailed check and use different equipment. I was just then in the process and in just going along with what appointments I had been given. And they did, looking back, they did say, oh, we can see something. But again, I was not thinking it could be cancer. It was just they could see something. So I was, I suppose, a little bit naive really and a bit unaware of what was happening, because I'm not somebody who ever used to go to the doctors apart from, you know, invitations like that. So I'm not really used to having like my bloods done or just having day-to-day appointments. So from there, then yeah, the first time that I was told about the cancer was at my appointment where I was diagnosed. I remember sat like waiting, and as doctor's appointments do, they were all running on and it was longer, and Oliver had dropped me off at that appointment. So then I got called in to see Mr. George. So there was Mr. George, there was a nurse, and there was 2 trainees in there as well. And he just basically told me that it was cervical cancer and that it was a tumour, which was just like a massive shock. And my first reaction was, what do you do? What can I do about it? They'd already had a meeting with the team, and they'd already like kind of got in place what the next steps were going to be. So from that point, it was again fairly quickly. But then they put me into another room where I could call Oliver to tell him. I think from that moment on, I felt like I was told everything, like, you know, we'd just been given this information, but I felt like leaving, like, I knew what the next steps were. And I think throughout the whole process, I have always felt that I could ask any question and we always got them answered. So yeah, it was a month between the smear and being diagnosed. They said, well, I could have a radical hysterectomy, which is a surgical hysterectomy. And because of my age, he said, I assume you don't want children. You know, we don't have any children, and we'd made that decision not to have children. So to me, just having a hysterectomy was like, it was fine, you know, I didn't have to think about it. But I can imagine in some people's situations that, you know, there is a lot more to consider. If you're younger, you know, it is hard, but it was, to me, it was just the only option really. I think what really helped me, like going into my operation, I was physically the fittest I'd ever been, because I used to like train quite a lot. One of my friends was a personal trainer, so I think that really helped me recover. And then the mental part of it, again, it was just, I knew I needed to have it done, and because it wasn't like a big impact, yet it impacts me. I've had it removed, but it was just, I just had to go along with the process really. I had my hysterectomy in November, and I had been told that I potentially might have needed some additional treatment but I wouldn't be able to find that out until after they'd tested the lymph nodes that they'd taken away. On a whole, the operation, it was a success. I didn't expect any additional treatment. I just thought it'd be the hysterectomy and then, back to normal-ish. But then it was my first appointment after the operation with the consultant, and they told me then that they'd found traces in my lymph nodes, so I had to have radiotherapy and chemotherapy. It was a relatively short course. It was 5 weeks. So Monday to Friday I used to go for radiotherapy, and then on a Wednesday I used to have chemotherapy just as a top up. So in an overall journey, it was quite a short course compared to what other people have, really. It was a bit of a blow, I think, because mentally I thought, right, after my operation that I'd be it. I'd be able to go back to the way I was and just get on with my life. So it was like 4 months all in all from start to finish, so it was just a whirlwind, really. Yeah, Oliver and I we never refer to it as being ill because I wasn't ill. Like, I wasn't ill before, so it was just something that happened. It was a little routine that you don't miss, but it was there for 5 weeks, and then it's just gone. So this year it'll be 5 years since I got diagnosed and had my treatment. So initially I was going every 3 months just for a checkup, and then it went to 6 months, and now it's yearly. Yeah, even when I think about it, I don't think of it as a negative. It's just something that I've been through. But I remember I had this like little tick chart as well, because I do like a list. So I'd made like a little list of like what all my appointment times were, and I took sense in pride of like crossing those off. And then at the end of every week, we're on my little family WhatsApp group, I'd take a picture, I'd be like, oh, week 1 done, week 2 done. Everybody would like send messages of, oh, well done. So that was quite nice. I'm personally liked routine, so it was quite good for me to be in that. During my treatment, my friend used to bring me flowers every Friday because she knew she couldn't do anything else. She couldn't come in and help me. She couldn't give me a hug. So whether she left them on the doorstep, whether like I managed to see her, but I kind of like relied on that. I liked that every Friday I knew I was going to get some flowers. So that was a real support to me. I thought naively that I'd be able to work through my treatment. I was like, oh, it's only in the morning. I'll be fine by the afternoon. I can, answer a few emails. I'll be fine. But after the first week, I was just like, no. So thankfully, I worked for 2 very understanding people that I was just able to take that time out just to go through my treatment, and then after the treatment, I'd just rest, and recover, really. I think it's important to talk about these issues because they can be resolved, they can be treated. Obviously not every case, but if things are caught early enough, then things can be done. And I want to be like proof that just go and get it checked, and then if there is something, there is a solution. I've learned that I've had to be quite strong and do things on my own, and I can do them on my own. Even though I do like people around me and I do like support, it is, I suppose, looking back, I can do it, and I have done it.
Hi, I'm Dr. Sam Wild, a Bupa GP and the Women's Health Clinical Lead at Bupa. I have been a GP for over 20 years now, and I've always had a specialist interest in women's health. Cervical cancer occurs when the cells of the cervix, the lower part of the uterus, become abnormal and grow uncontrollably. This is usually caused by the human papillomavirus, a virus which is transmitted by sexual activity. Most of us come into contact with this virus at some point, But the majority of people are able to get rid of this virus by themselves. Their body will clear it away. There's a small proportion of women that cling on to this virus, and they are the ones that are at a greater risk of developing cervical cancer. In the UK, around 3,000 people are diagnosed with cervical cancer each year. So it is relatively rare, but unfortunately it's often undiagnosed or misdiagnosed, particularly in the early stages when symptoms may be minimal or non-existent. This is why regular screening is so crucial. The key symptom to look out for is abnormal vaginal bleeding. So this may be bleeding between periods, bleeding after sex, or bleeding after the menopause. There may also be unusual vaginal discharge, or there might be pain during intercourse. However, early stages of cervical cancer often don't have any symptoms at all. This is why regular screening is vital. Early detection through screening allows for timely intervention, which can then stop the progression to cervical cancer. Common myths include the belief that cervical screening is very painful or unnecessary if you feel healthy or you've been vaccinated against HPV. So the truth is that cervical screening is usually quick, and whilst it might be a bit uncomfortable, it shouldn't be painful. And it's essential even if you do feel healthy, because we're trying to detect changes before these symptoms appear. The vaccine does not protect against all subtypes of HPV, and whilst it can prevent over 90% of cancers caused by HPV, it's not 100%. So you should still attend your screening even if you've been vaccinated. Personal experiences like Catherine's are incredibly moving and therefore motivating as well. Hearing real stories help people understand the importance of screening and can encourage them to take action to protect their own health. My key message is that cervical screening can save lives. It's a simple and quick procedure that can detect changes early and prevent cervical cancer. So don't delay, book your screening today and take control of your health.